All right, welcome everyone. Steph and I are very excited to present to you on preparing your loved one with ASD for medical procedures. You might have seen it was initially labeled as preparing your child with ASD, but in fact, many of the strategies and supports that we're sharing today really can apply across the lifespan. So we just want to be inclusive of all individuals with autism. So we will briefly introduce ourselves and then we'll get started. So I am Dr. Pineda. I'm one of the psychologists at the Lurie Center. A little bit about me and my background and how I got, to presenting to this topic today is I completed graduate school at the University of Florida, where I studied school psychology and really specialized in working with individuals with autism and other developmental disabilities. I completed my psychology internship at Kennedy Krieger Institute in Johns Hopkins, where I learned a lot of strategies such as systematic desensitization or ways to help patients tolerate and prepare for medical care and really decrease anxiety around medical care. And then I was fortunate to come to the Lurie Center both for postdoc training and then again now as staff to be able to apply and share these strategies that I've learned over time. And I'm so fortunate to be working with many of our families at the Lurie Center. And I will introduce you to Steph, who's one of our amazing nurses at the Lurie Center.
Hey everyone, I am Steph. I am one of the nurses. There's 5 of us total at the Lurie Center. I've received my bachelor's in nursing here right in Boston at Simmons University. And then for the first 11 or 12 years of my career, I spent it in pediatrics, primarily at Boston Children's Hospital in the emergency department and in outpatient ambulatory settings. And then a few years ago, I decided to go back to school with a love for educating staff and educating others. I went back, got my master's with a focus and concentration in nursing education. And just last year, I was also lucky enough to end up at the Lurie Center. And I have just learned so much from so many of our patients. And I've been able to take a lot of what I've learned in the years prior to coming here, working in pediatrics and in education, and look forward to talking to you all about this topic tonight.
Thank you, Steph. And so a brief overview of what we're going to be talking about. I'm going to share some information about barriers to medical treatment for individuals with autism, practical approaches and strategies that you can use to prepare for medical visits. I'll share a little bit about desensitization and the idea of practicing steps of a medical procedure to help your loved one become more comfortable or less anxious around a procedure. We'll share some patient-centered strategies and individualized strategies to help support your loved one during a medical visit, how to collaborate with medical providers. And then we're really excited to share with you a Blood Draw Toolkit that Steph and I have worked hard to launch just recently at the Lurie Center. So we'll tell you more about that and how you can get access to that if you would like to prepare for a blood draw. And then we'll take some questions. So first, I want to highlight some of the barriers to medical care for individuals with ASD. And I know many of you have a lot of experience, and there's probably Steph and I were saying we could spend a whole hour just learning from you as well. So we will have times in the presentation where we're going to pause and ask you to type into the chat, because I think that you as families and caregivers have a lot to share, and we may be able to learn from each other tonight. So briefly, I wanted to share some barriers to medical care that we know are common for children with autism. This includes that children with autism experience a greater number of medical visits. Oftentimes, the length of visits can be 2 times longer. Sometimes this can be due to medical complexities or difficulties with anxiety or behaviors that can interfere with completing steps of an exam. And overall, they can experience a poorer quality of healthcare. We know that non-compliance with medical care is a widespread problem, but particularly for individuals with disabilities. And unfortunately, this often leads to the need for restraint, sedation, or anesthesia to complete medical care that's needed. And so this is really something we want to avoid, when possible. Of course, there's times where you have to do these things, but when it's possible, we don't want to have to resort to restraint or anesthesia to get work done. I wanted to highlight some barriers for adults with autism. So we know that adults with autism are more likely to be hospitalized or visit an emergency room compared to typically developing individuals. There can be increased rates of mental and physical health problems and an overall increased risk of cancer compared to individuals without autism, although this is really for individuals who have comorbid intellectual disability or birth defects. So there's other risk factors that go along with that. We know that individuals with disabilities can experience, there's actually emerging evidence to show that individuals with disabilities are less likely to complete preventative health screening. So things like colonoscopies, mammography, screening for cervical cancer. And so this is a really big problem, and we want to help improve access to medical care to help improve quality of life and mortality. There's a wonderful paper that's now available that our own Dr. McDougall and Dr. Tom helped to write, but there's a paper on cervical cancer screening for females with autism. And it's sad to report, but it really looks at whether or not females either completed HPV vaccination or had a pap smear. And basically, the study showed that about 40% of adolescents and 34% of adults with autism were fully vaccinated for HPV, and only 31 out of 82, or 38% of adults in the study, adults with autism in the study, received one pap smear. So there's a striking need to really increase access and completion of preventative care screenings. So I wanted to briefly ask you as the audience to type into the chat, if you can, what are some barriers that you or your loved one has faced during medical care? And I'll give a few seconds, I'll give like 20 seconds or so to kind of see if there's some responses there that I can share with everyone. I know that families experience a lot of barriers, but it would be great if you want to share any specific barriers that you've encountered during medical visits. I don't see any comments yet, but okay, yeah, so vision screenings for people who are non-speaking, absolutely. I know this is a challenge that Dr. Bath thinks about often. That's certainly a barrier. Feel free to continue to type and we can come back to the chat. So finding a doctor who understands anxiety, absolutely. Coordinating care with other providers, sensory issues. I love this. It's coming through. So you're really highlighting so many of the common barriers. Blood draws. Yes, we hear you. We hope we have some strategies to share with you. Not being understanding of medication refusal, like not understanding that just bribing won't work. Yes, absolutely. A lollipop only goes so far, especially as you get older or things get more complicated. Finding a doctor who deals with nonverbal people and their needs, absolutely. That's a very big challenge. Gyno care, anxiety and stress. This is so helpful. Thank you. Again, I wish I could spend an hour just listening and hearing your barriers, and maybe one day we'll do that, because I think there's a lot that we as providers and our healthcare system can really learn from you. So thank you so much for sharing. I want to highlight a study that is actually available that really asked about some of these barriers. But what's really interesting about this study is I think it really highlights the different perspectives. So healthcare providers and parents were asked what they felt the barriers were during a healthcare encounter for children with autism. And healthcare providers, the majority of healthcare providers said that a child's behavior was a challenge or made it difficult to complete a visit, that they might have been uncooperative or they were unable to complete a physical exam. The child was fearful, so anxiety being a big component. I think that we're speaking, the same language from providers and parents, and then that parents can be overwhelmed, which is absolutely understandable. And from the parent perspective, one of the number one things that parents shared was that the provider or staff didn't understand the impact of their child's autism. So again, finding someone who really understands your loved one's needs is really important, and that can be a challenge. Environmental issues, I think someone mentioned sensory issues. So even just being in that waiting room and the lights and noises, and the anxiety that builds up as you're waiting to see the provider, all of those can make a healthcare encounter more difficult. And we know that there's a fast pace of office. Unfortunately, this is kind of just how the healthcare system works, but oftentimes there's a brief period of time, and some individuals might need more time to get comfortable or to communicate. And so that can be a challenge and barrier as well. I wanted to highlight another study that I found where autistic self-advocates, adults and adolescents with autism, were asked about their experiences during a primary care visit or in a primary care setting. It's a great article if you want to read more about it, but this graph shows basically a focus group of autistic self-advocates shared about what made them feel most anxious during a medical visit. And it kind of graphs the level of anxiety or stress that they had over different steps of a medical visit. And you can see they started to get like a little bit anxious even when they're at home, maybe just thinking about the visit, checking in, their anxiety started to spike. And then the waiting room, there was a lot of stress that came up. And so this focus group shared some solutions. So things like accommodating their sensory needs or being able to go to a quiet space and have some control of their environment, or being able to have distractions available to them to help decrease anxiety during their time in the waiting room was helpful. Their anxiety or stress also spiked around the time that they were in the waiting in the exam room and actually speaking with the physician. And there's some good comments from autistic self-advocates that really speak to the fact that the social communication dynamic is really challenging, and their anxiety really increases because of the social nature of communicating with their provider. So being able to write down questions and go in with a plan helped decrease anxiety a little bit, and making sure that a provider really understood their communication needs was very important. I also like that the focus group highlighted increased stress when they were checking out and making their next appointment. So just a lot of anxiety around medical visits in general. I wanted to highlight that one negative experience can really have long-lasting effects. So we know that some people experience medical anxiety and there's not a really traumatic experience, but unfortunately, we've seen a lot of our patients have had traumatic or challenging experiences in medical settings. So this can often lead to increased anxiety even leading up to a procedure. So I have many families that say getting into the car to go to the medical visit, walking into the building is really challenging, waiting in the exam room. So I really understand the challenge, even just that you've had to get your loved one to a visit. And so I think it's important to note that just if there was one kind of really traumatic experience or even repeated just stressful experiences, your loved one can build this association with the doctor and not want to go or make it more challenging in the future. So I always like to stop and think about when is a procedure really urgent? So there's times where there's emergencies, you have to do something, you don't really have a choice, you may need to use restraint, and that just needs to happen to get the care they need. But I like to stop and think, when can you take time to prepare for a procedure, take a little bit of extra time to think about accommodations, or advocate for, how to make that procedure smoother for the future. So, that's one thing I think about. I would say the other thing I think about is, are there parts of a procedure that could be eliminated or accommodated completely to make a patient more comfortable? So for example, I would say a large portion of 95% maybe of the patients that I've worked with who are getting ready for a blood draw will tell me they don't want a Band-Aid. It's another sensory experience to have to rip off the Band-Aid. I mean, I see this with my own children. So if you go for a blood draw, it's very easy to advocate for adhesive wrap or Coband or Coflex instead of a Band-Aid, so you don't have that negative experience. So there's little accommodations that are very easily change to make an experience a little bit better. I want to highlight that, we know that anxiety can be a good thing. It can make you more alert or aware of your surroundings, but really in medical settings, it becomes a challenge because oftentimes anxiety leads someone to maybe avoid care or, try to get out of that blood draw that they really need to do. And while it might lead to kind of brief relief in the moment, really it just leads anxiety to grow more and for it to be more difficult the next time they need to have the care that they need. So I wanted to highlight some strategies on things you can do to prepare for medical procedures and start to help decrease anxiety. Some of the examples I'm sharing with you are focused on vaccines and blood draws, but these strategies can be really applied to many different procedures or medical visits. So the first thing I would recommend is to talk about it. There's a tendency as parents to not want to talk about it, knowing your loved one is nervous. I feel this the same way with my children when they have to get vaccines, but it's really important to talk about what needs to happen to help them prepare. I would start with talking about what it is that they are going to be completing and why it's important. So for example, if I was preparing my loved one for a vaccine, I would describe it in language that's familiar to them. And this is very individualized. So some people might want more details and might want to know the intricacies of how the vaccine, about vaccines. And then others might just need to know it's a shot that helps protect you from getting really sick if you get an illness. I would talk about the benefits of getting a vaccine. So in COVID times, it would, even now, it still protects you from getting sick. In COVID times, it would allow you to see friends and family or do activities you enjoy. You would talk about the risks of not getting it. So both the pros and cons. And then I would set an expectation to say, we're going to work together to get ready for a vaccine in a few weeks. This is going to happen. And be honest about what to expect. If you take anything from this slide or from this talk tonight, I would just say honesty is really important. So don't say it won't hurt. Try to be honest, because oftentimes if you say it won't hurt and it does, it leads to distrust in the future. So I will say you don't have to talk a lot about the pain, but I will say something like you'll feel a brief pinch or pain, but it'll be over quickly and I'll be there to support you. I think particularly around things like the COVID vaccine, we know there's side effects or you might feel sore or tired. So being able to give them more information about what's happening to their body and what to expect is really important. I would say the next step, besides talking about it and setting the expectation that you're going to be working together to prepare for a procedure, is to read a social story or look at pictures of what to expect. There's a lot of social stories available online, but I think it's really important to help talk through or to see, either just physically see the steps that someone will experience or to be able to understand just different aspects of a procedure. And it's important to find a resource that matches your loved one's communication needs. So for someone who wants more detail, you can find something with more language. For someone who has more limited language or is nonverbal, I would suggest just finding pictures or I'll talk about videos of the steps of a procedure. I wanted to pause and highlight a really exciting project that I've been working on in the last year and will continue to work on. Thanks to the CGL Foundation, I received a grant to create social stories on preventative care procedures for adults with autism. So things like preparing for a colonoscopy, blood draws, primary care visits, completing a mammogram, cervical cancer screenings. A few of these are already available on our Lurie Center website, and we will continue to add them over the next few years. So be on the lookout for more resources. Beyond looking at a social story or pictures of what to expect, I would recommend looking for videos of a procedure. There's a lot of videos out there that walk through maybe someone's experience during a medical visit, but I find that videos are really helpful because it shows in real time what's happening and adds a different element of kind of explanation or communication of expectations. It is important to look at those videos and screen them before you show your loved one and make sure no one's having a really aversive reaction. You don't want to show them that. The next step you can take is helping them become familiar with the place where they will complete a procedure. So this is just an example of, CVS. If you were getting a vaccine at CVS, I might recommend, making a visit to CVS and just walking around, not even looking at, the pharmacy area or the area where you get a blood draw. And maybe the next visit you go and you walk by and see, where other people are getting vaccines. So just decreasing anxiety around the location and increasing familiarity with the location can help make the day of procedure a little bit better. Some medical providers are really accommodating and might let you make a visit ahead of time or see the space where you'll be. So this is really more of a communication you might want to have with your medical team, but it is something I find very helpful. And finally, I would say one of the most important things you can do if you're able, or if it's a procedure that you have the ability to practice at home or even practice parts of a procedure at home, this can be one of the most effective things to help decrease anxiety. So you might start by having your loved one practice on, actually you might model. So you might have someone practice on you or have your loved one practice on you and be the doctor. This allows them to get more comfortable with the stimuli that they might see, or think about, what a vaccine might look like and hold it on your arm. We can talk more about some examples of how you can practice this at home. But actually showing them and having them practice on you is a great first start. But eventually being able to transition and practicing the steps of a procedure on your loved one is very helpful. It's a type of exposure therapy and way to introduce materials and decrease anxiety with a gradual kind of process or introduction of the steps of a medical procedure. So I'm going to pause again briefly and ask if you can type into the chat, so what are some steps that you've taken to prepare for procedures at home? And this could be medical visits, dental visits. I'm sure there's a lot of creative caregivers out there. So if you want to share any ways that you've helped prepare, I'll give the group a few seconds to type into the chat. Social stories, watching videos on YouTube. Yep, YouTube is a great resource, absolutely. Explaining every day for a few days leading up to it, so there's no surprises. Excellent, I love that. So kind of a repeated reintroduction, explanation of expectations. Talking about the appointment and what it's going to be for, absolutely. So I find that the explanation of why you need to do something or why you're having an appointment has actually been a huge help for many of my patients. If they have the communication skills to really understand the why, that explanation can be very, very beneficial. Thank you so much for sharing. So systematic desensitization really gets at this idea of this gradual practice of steps of a procedure. It's basically a very effective treatment approach. There's decades of research to show that systematic desensitization helps with decreasing anxiety for medical procedures. And this involves gradually and systematically increasing exposure to a feared stimulus, such as steps of a medical procedure. It's often combined with the use of relaxation strategies or distraction. Distraction is the number one tool that we know can help decrease anxiety during medical visits. So if anyone's been to, a dental visit where they have a TV screen with a movie playing up ahead, I love that because it's just the perfect example of how distraction can be so beneficial. When you're practicing steps of a procedure, you also want to really provide a lot of praise around what your loved one is doing well. I love the way that you're holding still. I love the way that you're being brave. I think just noticing what they're doing well and letting them know that is really important because that increases the likelihood that they will continue to do that or try to do that in the future. And you want to try to limit attention to unwanted behavior. So I think there's always this challenge of you want to let them know that you're there to support them, but if they're whining or kind of getting into this back and forth of like, no, 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 I don't want to do this. And if you get stuck in that conversation and that back and forth, it's often unproductive. So just trying to focus on the positive and what's going well and limit attention to unwanted behaviors is the most effective. There's a lot of research to show that this kind of approach has been really helpful for increasing tolerance of many procedures. So things like blood draws, MRIs, EEGs, vaccines, you name it, it can really apply to a lot of different medical visits. This is a task analysis, or basically a breakdown of all the steps that someone would need to or could practice when they were preparing for a blood draw. And actually, I use this during individual work with when I'm completing desensitization with families, or I'll share with you a parent group that I provide on parent workshop for desensitization. But basically, practicing the steps of a blood draw with a butterfly needle, with the needle removed, not a real needle, and a paper clip inserted, because the paper clip looks a lot like a needle. And actually, if you put a little bit of pressure on the paper clip, it feels like a pinch on your arm. So it's a really effective way to mimic what it's going to be like when you complete a vaccine. I see a familiar face in the audience, but I have a wonderful patient who who was my wonderful model for this task analysis, or these visual steps of a blood draw, who had a lot of anxiety around blood draws, but really did an amazing job working to do desensitization and practice the steps of a blood draw, and then successfully completed a blood draw and did fantastic. So my model patient here kind of shows you the steps of a blood draw. And this is a great tool to show your loved one, or look at with your loved one, to show them what to expect. I also wanted to highlight, this is a task analysis, or basically the list or steps that someone would need to complete for a vaccine. So much fewer steps than a blood draw, but you can get something as easily as this. There's a kit. This kit is on Amazon. It's actually syringes to help apply lubricant to a bicycle. But if I'm practicing for a vaccine or want to get ready, I would get, this kit is like $7 on Amazon. Or something similar. And I use these thin needles with a black cap, and I might practice holding it on someone's arm for 5 seconds and then 10 seconds. But really, a vaccine's probably done in 2, but I always over prepare. Then I might practice holding a smaller needle and then a bigger needle, so that it really mimics what the vaccine will look like. So this is a great thing that you can do at home and easily practice and prepare for. And sometimes I'll have individuals even just like be able to like hold the syringe with no needle on it, just to get comfortable with looking at it and seeing it, so that they're less afraid of all the things that they'll see when they actually go for the vaccine. And again, this is a visual task analysis, or a breakdown of the steps of a vaccine, that is a useful tool that you could use to look at with your loved one if you're preparing. So in summary, as far as preparing for procedures, if I had to kind of put this into like a how do you do this, I would say start with learning about the expectations that your loved one needs to, or the expectations that your loved one would have to tolerate in order to successfully complete a procedure. So what needs to happen in order for them to be successful? How long is it? How long do they have to hold still? I might ask, what are common challenges for other patients, or other patients with autism? What staff are available to support you? Then I would, after you learn about those steps, I would identify potential challenges or barriers. If your loved one has communication skills to be able to tell you how they're feeling about each step by looking at each of those pictures, I find that incredibly helpful. And I've learned so much from my patients, where I might assume the needle is something that makes them most anxious, and oftentimes it does. I would say I've learned so much from my patients, where sometimes it's really the idea of a nurse approaching them and touching their arm, or it's the tourniquet that makes them feel most anxious. So being able to really just sit with them and ask them how they might feel, whether it's on a scale of 1 to 5, how worried they might feel, or simplifying it to not worried at all, a little worried, very worried. You can learn a lot from your loved one by having them look at the steps with you and tell you how they might feel. And then if they don't have the communication skills to tell you, or even if they do, I find it very helpful to think back to past experiences. So what challenges and successes, what worked, what was helpful, what didn't work or made things go, downhill. So being able to think back to the past is really helpful for preparing for the future. I would say, as I mentioned before, practice the steps that are possible at home. So it's not possible to practice every step of every procedure. But one example is I have another lovely family who was preparing for a procedure where they had to go under anesthesia. And so they got a mask off of Amazon and just practiced having the mask, on their child's face for 1 second, 3 seconds. And that helped their child be more successful when they actually went in for the day of the procedure. So there's little things you can do. I would say it's really important for you to advocate for accommodations and staff support. So asking if there's people like child life specialists available to support your loved one, or staff with experience in supporting individuals with special needs or autism. It never hurts to ask, and I would certainly encourage you to advocate for that. And then bring distractions. So pack a bag and bring everything that not everything, but bring the things that your loved one enjoys and could be a really useful distraction that's going to keep their mind busy and off, help decrease anxiety, because we know distraction is one of the number one tools. So whether it be a phone, an iPad, a book, anything related to their preferred interests, all of these things can be really great distractions. And so I highly encourage you to bring a bag and be prepared with some things that's going to keep their mind busy. I'm going to pass it over to Steph, who's going to share some strategies to support access to medical care with you.
Thanks, Jill. So like Jill said, we're going to talk about some ways, some strategies to help support patient access to medical care. You can go on to the next slide. So communicating is going to be, and advocating for your loved one is going to be such an important step. Ensuring that you have access to the patient's choice of communication throughout the entire visit, whether it's spoken language, using an AAC device, a whiteboard, visual supports, all of these things. We want to make sure that we have them with us during the medical visit. Supporting your loved one in developing a list of written questions and concerns ahead of time. Jill touched upon this, but really talking about the anxieties that your loved one is feeling, and if they have any questions, these are really important things to do or think about ahead of time. That way, when you come to your visit, you can have a list ready. In some ways, you could send a list even ahead of time, either whether it's by patient gateway or connecting with your provider, or if you know the provider who's going to be present at the time of the medical visit, you could even ask them ahead of time and communicate the concerns ahead of time. Encouraging the provider to address the patient directly is another important step. Although this is not universal, some patients don't want to be addressed directly, but you want to make sure that regardless of the way that your loved one wants to be addressed, that you advocate for that. I actually recently had a patient for a blood draw at the Lurie Center, and their mom stopped me before I even went in the room. We had a discussion. The patient's group home staff was there present to help support the blood draw, which they anticipated being difficult. And the patient's mom said to me, "Go in there, don't say anything." And although that was really difficult for me as a provider, because I want to talk to my patients, I want to connect, I want to ask what can be beneficial, what cannot be beneficial. It worked. It worked when I listened to what the guardian advocated for. I went in, I said nothing. I just did my job and I walked out. And the mom was really grateful because she recognized the fact that it was difficult to go in and say nothing. And it worked. It worked so well. So just making sure that you're really communicating what your child or loved one's specific needs are, because not everybody is the same. Go ahead, Jill. So support understanding of expectations using visual supports like Jill had mentioned, doing modeling or demonstrating expectations at home. We'll talk a little bit more about this in regards to blood draws, but anything, if you can try to figure out a way to mimic it at home, can really be helpful. Like Jill said, with the mask or with a blood pressure cuff to practice vital signs or practicing getting on a scale for a weight, even the simplest things at home, if you practice them consistently, can really make a difference in the level of exposure to prepare them for the visit. First and then boards are really great. You can show a picture of, first we're going to measure your blood pressure, like this photo, and then you get to play Legos. So there is an expectation of what needs to be done. You just have to make sure you can follow through with the then. Again, you don't want to develop any kind of mistrust. Visual task analysis, like Jill had mentioned, these are images that take you through the steps of any given task so you can see what they look like, have a better expectation. Visual and audio timers are also great in a way to set expectations as well. And Jill, you can move along. So incorporating distraction, preferred interests, Jill did talk about this a bit, but distraction techniques can be one of the most effective methods to minimize a patient's procedure-related distress, self-reported pain, and increased relaxation. Jill had told me in making this slide that she put the scrub cap there because even something as small as a provider, she was saying a provider put on a scrub cap that was a specific interest of the patient. And so when the patient went in for what I'm assuming was a surgical procedure or something under anesthesia, the patient realized how special that was, that the provider took the time to connect with them and they were able to connect over that. So it just is another way to really think about how, as providers, we can help bridge the gap as well. And then, of course, toys, distraction, music, conversation about interests, which is what the scrub cap helped with, counting, watching videos, looking at pictures on the phone, reading a story. One thing I also find super helpful in a medical setting is I Spy. I feel like I Spy is a really great way to keep distracted and to help take in the visuals of the space that you're in. So that's always like a nice little, and it doesn't require anything. So if other things are failing, you can try that without needing anything brought from home or whatnot. So you can go to the next slide. So how do you collaborate with medical providers? I think a big part of this collaboration starts with you advocating for your loved one's needs. You're the expert on your loved one. And it's important for us as providers to acknowledge that and appreciate that and really take what you're advocating for to heart and to make changes based on it. So share your loved one's preferences, their communication needs, anticipated challenges, and at what works, what doesn't work for those challenges, if you have any experience from the past. Discussing the plan prior to starting the procedure. Staff should, or if preferred, not tell. It really depends on the patient. Sometimes they want to see everything and know everything and touch everything and whatnot, and really to engulf the whole experience. And then other patients want nothing to do with looking or seeing or feeling. So again, it's a very individualized approach, but making sure that you advocate to staff to ask them to tell and show if that is what your loved one is preferring. And then before we lay our hands on the patient, it's really important for us to show any equipment involved or let the patient touch that equipment if it's safe to do so. Touching and feeling the items can be really helpful. So another question for you guys: what accommodations have you advocated for during past medical visits? This could, be something you've thought about after the fact or something you advocated for that you think others would benefit from knowing as well. Jill, I it mentioned there a sleep study kit. That was I don't know if that's on your list of visuals or, but that would be a great one to add. Same thing with EEGs with all the nodes on the head. It can become very overly stimulating sensory wise. Counting down, that's a fantastic um, way to prepare somebody for what's going to happen. Not saying the word shot. It's also super helpful. And again, some people want to use certain words or prefer to have very specific terms used or not used. Shorter waiting times. At the Lurie Center, we try to arrange that ahead of time if that's a particularly challenging area for patients, which most of our patients struggle with waiting. Not wearing scrubs. Oh, not wearing scrubs into surgery, wearing pajamas. Absolutely. Limiting waiting times, blood work at home, all fantastic. All right, perfect. All right. Thank you so much for everybody with all of your feedback. Jill and I are going to have to go through everything and make a list of the things we're learning from you guys tonight. So additional resources, particularly if your loved one is going to be having an upcoming appointment, test, or procedure at the hospital or MGH in Boston, we take some of these things into account at the Lurie Center as well, but they're not all available at ambulatory sites. In Boston, say you're having a procedure for a surgery, endoscopy, or something like that, we have something called an accommodations care plan. These are available to all patients. It provides a notification on your electronic medical record that alerts us and all providers who access the record, and therefore some people who may not be familiar with your child. And it helps us understand the accommodations that we can provide in a medical setting to make it a better experience for your loved one. So they do take some planning and implementing. So we want to make sure that we, meet with our family support team or the right staff to get the accommodations care plan up in the system before the actual procedure day. And then a child life specialist. Sometimes they're available, sometimes they're not, but we always can advocate for one during a visit if distraction tools are needed, or you anticipate a long visit, maybe the emergency room, or again, a procedure in Boston. Child life specialist can be a great resource to reach out and ask for. And then we have Karen Turner, who is our wonderful patient navigator for autism at Mass General. You can go to the next slide because it talks all about Karen. She gets her own slide because she's just that wonderful. So Karen Turner is our MGH patient navigator for autism. She works with providers to enhance understanding of unique communication, sensory needs, behavioral needs for our patients with autism or intellectual developmental disabilities. It's helpful to consult for inpatient procedures with increased complexity. Preferably if you can do it before the day of, it takes time to plan these things. And so if we can meet with her or staff before the procedure or complex procedure, then she's able to try to help get the appropriate staff or child life specialist or educate staff to what could really help make the experience better that day. She created was on a team of people who created the accommodations patient care plan for autism and developmental disabilities at Mass General. And like I said in the prior slide, these are a wonderful resource to help us across the board understand how to properly care for your loved one. And then there's just additional information. All right, we're going to have to get to our Blood Draw Toolkit quickly. So Blood Draw Toolkit is a new initiative that Jill and I started at the Lurie Center. Can keep going. It has three components. One is this, what you see here, which is a guidelines tip sheet for parents, or guardians, or for patients themselves. And it really has ways to prepare for an upcoming blood draw. Has a visual task analysis, and then a survey link at the end, and also a link to additional workshops that we have at the Lurie Center. In addition to the tip sheet, we have a social story that goes through the steps of receiving a blood draw with lots of visualizations. It is able to be personalized so that you can put your own doctor's picture in there, or times of day of the appointment, or other expectations. So that is a nice feature of it, that it can be editable. And then lastly, there is an actual toolkit. So this is what the toolkit looks like. It has all of the items that you would have experienced during a blood draw. There is no needle. We have removed all the needles and put paper clips in the kits, so you can practice at home. And that practice at home over the weeks leading up to the blood draw can really decrease anxieties and hopefully help have a more successful blood draw. And so how do you request a kit? So you can ask any provider or staff member at the Lurie Center, let them know that you're interested in a kit, and they will let me know. They will give me your information, and I will connect with you to get you the additional materials. You can reach out to me directly at Lurie Center Nursing at partners.org by email, or my direct line at the Lurie Center is listed here. In that message, if you could leave me the patient's name and date of birth, and that you're requesting a kit, and then I'll be in touch to help you get everything you need to use it at home.
And I just wanted to briefly jump in and say, I think I saw a comment earlier in the chat that distraction alone isn't helpful, and I absolutely agree, and I hear you. Many patients will also take medication, PRN, and so what I know is that many of our patients really learn best through doing and seeing and feeling and experiencing. And so that's why this physical toolkit piece and the physical practice of the steps of a blood draw or a vaccine are so helpful. It really aligns with the literature that we know, that gradual exposure and practice helps decrease anxiety. So that's why we wanted to make sure that we're making the physical toolkit available to you, because feeling and touching the tourniquet and practicing tying it on the arm, that is just as important as, if not more important in my experience, than medication alone or distraction. So it's really the combination of these strategies that is going to be most effective in helping your loved one prepare for something like a blood draw, and really any other procedures that you can prepare for at home.
Awesome. I think we can move to the next. So what's next for the Lurie Center Blood Draw Toolkit? So we've shared our project with the Lurie Center staff. So in hopes that if you were to call or to mention at the desk, I really am interested in trialing this kit, everyone will know, and they'll contact Jill and I, and we can help get you started. We continue to disperse kits at the Lurie Center patients and analyze feedback to make positive improvements. So just like tonight, we're gathering all of your experiences. Patient experience really will hopefully help mold this project into, if we can make improvements. We have presented to many Mass General providers outside of the Lurie Center and have received really positive feedback and requests for support in multiple locations throughout MGH. We're establishing a website with these resources and guidance on implementing the toolkits in other settings. We continue to spread awareness about our project and goals to support patients with autism and intellectual developmental disabilities receiving blood draws throughout MGH. So we know that you can't always have your blood drawn at the Lurie Center. And we hope to educate all Mass General providers who complete blood draws on caring for patients with autism and intellectual developmental disabilities. So that would be really big win for us if we could educate or create education for all staff who are going to be interacting and drawing blood from your loved ones. Yeah.
So I just wanted to briefly highlight that I do run some parent desensitization workshops or workshops on things like preparing for vaccines or blood draws, pill swallowing, and then a 3-session parent workshop that gets more into the details on desensitization, behavioral strategies to measure and respond to anxiety. So if you feel like you need more help at some point, we're here and we have these workshops available to you. And then we also wanted to share there is this Adult Autism Health Resources website that has some great information and resources for adults. So I encourage you to check that out if your loved one is an adult. And we wanted to pause and take questions, and we can also look through the chat and see if there's anything we missed along the way. Thank you so much for being part of our presentation tonight.
Thank you. One thing I noticed in the chat, Jill, was someone had mentioned for an EEG, they visited in advance and they let them borrow the electrodes to practice at home and play with. I think that's fantastic. And again, just like the blood draw kit, the practice at home and the exposure and desensitization work is just really such a has positive benefit.
Yes, it's fantastic to see providers kind of share this and think outside the box. I think all of this is really, working with providers or thinking, with your loved one, like thinking outside the box of things you can do to prepare or accommodations that could be helpful. So it's so nice to see that and hear that. I think someone had asked about the sleep visuals for sleep study. I have not yet created that myself, but I know that there are a number of resources online. So I would suggest kind of Googling, but I found some good sleep study visuals. You can also check out our Lurie Center website. We have a page on social stories that we're actually in the process of updating. So you can kind of keep monitoring that. We do have the blood draw social story and a social story on preparing for colonoscopies on our website already. And we'd like to, we do have editable versions, but right now the website is kind of limiting what we can upload. So we're trying to problem solve, but we're hoping to have all of these preventative care procedure social stories for adults. And I say adults, but really they could be used for adolescents and children as well. But I think in our experience, a lot of times the social stories that are out there are really directed towards children. And so it feels a bit inappropriate to be looking for, social stories with kids in it when you're supporting your adult loved one. So be on the lookout for more resources for adults on our website in the coming months. Any questions or comments or other ideas and strategies that the people want to share? Thank you. Yeah, we hope to understand. And again, we know we still have more to learn. And I think our patients teach us things every day. So we're just fortunate to learn from our patients and families. So we appreciate the feedback that we get and just appreciate the opportunity to work with our families so that we can help make healthcare more accessible. And I do see Miss Nolan shared that numbing cream is really helpful. So that is embedded in the social story, but yes, absolutely. Numbing cream for a blood draw, I would highly recommend. We know that research suggests the use of numbing cream. So something like Emla or lidocaine that you would have to have your provider order it ahead of time, but it numbs the outer layer of the skin. And some patients who apply the numbing cream, usually you have to apply it 45 to 60 minutes ahead of a blood draw on both arms. Do both arms. I've learned that from experience because you never know which one might be better to find a vein. But if you apply numbing cream, that can be really helpful. But it's really the combination of numbing cream, distraction, provider training, and all of the things that we're talking about tonight. So yes, consider numbing cream. Thank you. all. So yeah, you will have access to these slides and this recording. And we're here as a resource if anyone needs more support in the future.